Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of the Department of Health, Seniors, and Long-Term Care. Does the Honorable Minister have an opening statement?
I do.
Minister.
Thank you, Chair. On behalf of the Department of Health, Seniors, and Long-Term Care, I am pleased to present the financial estimates for the 2025-26 fiscal year. Our government is committed to rebuilding healthcare after years of neglect by the previous government. We are committed to ensuring that those on the front lines are treated fairly and with respect. We are committed to improving patient care and ensuring that all Manitobans, no matter where you live or how much money you make, are able to access and to have good quality public Canadian healthcare. Indeed, at a time when our national sovereignty is under threat, when our neighbor and former ally has launched a trade war against Canadian jobs, and when far-right politicians seek to undermine our public systems, it is important to reaffirm our collective and fundamental Canadian values. Public health care is one of those values. Canadians agree, Manitobans agree, no matter your income, you should get timely, quality care. Healthcare should be equitable, it should be accessible, and it should be universal. That is the Canadian way. Budget 2025 reaffirms this notion. Budget 2025 marks a historic turning point in our commitment to rebuild and strengthen Manitoba's healthcare system. The Department of Health, Seniors, and Long-Term Care is allocated $8.8 billion, a historic increase of $1.2 billion. Of course, when we include the broader health sector, the summary budget for 25-26 totals almost $9.4 billion. That is an increase of over $1 billion, over 14%. Manitoba's top priority is healthcare. That is why they elected our government. The previous government was at odds with Manitobans on this very important priority. For 2 terms of government, our healthcare system was neglected, cut, and dismantled. And so many of the challenges we see in healthcare today are a direct result of their bad decisions. 3 major emergency departments were closed, resulting in overcrowding and long wait times all over Winnipeg. Rural emergency departments were shuttered all across our great province. Hundreds of staff were fired or quit after years of disrespect and being ignored by those in the previous government. No investments were made in building capacity, and instead, patients were sent to the United States not only out of province, out of country, to receive the care that they should have been receiving here in Manitoba, and receiving that care out of country at private clinics. Meanwhile, institutions like the Cardiac Centre of Excellence, a jewel in our province, an internationally renowned institution, was dismantled piece by piece. A program that was the envy globally was torn apart by the previous government, leaving Manitoba patients without streamlined cardiac care. And now, with a new leader at the helm of the PC caucus, it is clear that if they were in power, they would take it even further. The PC agenda is to bring American-style healthcare right here to Manitoba. The PC leader sat at Heather Stephenson's cabinet table when she cut healthcare, when she dismantled these invaluable structures that provided great care to Manitobans. He supported the previous government's cuts, and he's been silent about that harmful record. He's refused to say if he thinks the cuts were a bad idea. I noticed that the leader of the PCs lost the constituency of Turtle Mountain in his leadership campaign. Lost the constituency of Turtle Mountain in his leadership campaign, and lost it by quite a bit when you do the math. I wonder if that's because his government closed the Carberry ER in that very community. I have been to that community. I have met with the wonderful people of Carberry alongside the Premier, and we had the pleasure on a really wonderful sunny day to reopen the Carberry Emergency Room. The people of Carberry are good people. They are good Manitobans. They deserve quality health care. And that is where we stand on our side of the House. But I am not so sure where the leader of the opposition stands on this issue. He supported the previous government and Heather Stephenson's move to cut health care and close emergency rooms every single step of the way. The leader of the opposition went as far recently as to thank Donald Trump for the tariffs that are creating so much instability in Manitoba households. And yet again, the opposition finds itself very much on the other side, the other spectrum of the issue that everyday people, everyday Manitobans are on. The PC leader likes American tariffs. We know that now. He likes American-style politics, likes American-style healthcare. Fortunately, where they are at odds with Manitobans, our government is very much on the side, the same side of Manitobans. We began repairing the damage done to healthcare by the PCs in our first budget, last year's budget. Last year, we began fixing the relationship between healthcare workers and government, and we've hired a net new over 1,600 healthcare workers as a result. We recognize there's much, much more work to do, and we're committed to doing that work. We signed historic collective agreements that finally brought fair deals to the frontline workers after the previous government refused to negotiate with them at all and froze their wages for years. We ended the practice of funneling money into private for-profit American clinics and instead began building up our public health care system right here in Manitoba by investing beds, hundreds of beds, and surgical slates. We've increased access to primary care to alleviate burdens on emergency departments. We've improved safety measures in those very same emergency rooms. We began construction on the Lac du Bonny Personal Care Home and took the first steps of rebuilding the Victoria Emergency Department. And despite mockery, ongoing mockery, quite frankly, from the opposition, we met with and we continue to meet with frontline staff in their workplaces as part of our listening tour, where they shared their ideas on how to fix healthcare in Manitoba. We know that solutions are found at the bedside. They're found on the front lines, not in the boardroom. And so with that in mind, we instructed health authorities to redirect funding from the bureaucracy, from internal bureaucracy, directly to the front lines of our healthcare system. Fixing healthcare is a long-term budget. It's a long-term approach and project. It will not happen overnight. It will take years, but Budget 2024 reestablished a foundation for that to be built upon. And Budget 2025 begins the building. I want to be very clear that our government is committed to supporting the front lines. We understand that patient care begins with those who deliver it, and our government is stepping up to meet the front lines where they've been for many years. Budget 25 builds on the retention and recruitment efforts of our first budget. We know that under the previous government, Manitoba was losing healthcare workers. Frontline staff did not want to work in such a toxic culture. Our government, on the other hand, values frontline workers. That's why in Budget 2025, we invest an additional $780 million into frontline staffing. And we're working very hard to make workplaces safer. We've hired over 100 institutional safety officers across Manitoba, and more, dozens more, are on the way. We've installed weapon scanners at Health Sciences Centre and introduced amnesty lockers. We've upgraded security equipment and lighting around sites, making the environments more safe. We're investing in flexible childcare spaces and expanding the provincial travel nurse team to support rural and northern care. And as part of our $48 million investment in training frontline staff, we're adding 176 new training seats across the province for healthcare professionals. We're making Manitoba a place where healthcare workers want to work again. Budget 25 puts shovels in the ground for emergency departments like Ericsdale and the Victoria ER. It includes $7 million to renovate the Children's Hospital Emergency Department. We know that is such an important space for children and families in some of their scariest healthcare moments. We've added 97 fully staffed beds to relieve bed block, in addition to the more than 240 beds that we've already added and staffed. We've stood up a lower wait times and system improvement team focusing on improving emergency room wait times. Fixing the mess the PCs left in our healthcare system, in our emergency rooms, is a key element to fixing healthcare overall. And so we are continuing to do that work. We're building on the expansions we made last year in primary care, and primary care is a big part of this conversation. Last year, we saw over 138 net new doctors here in Manitoba. I know I'm running out of time, Chair, so thanks.
Thank you, Minister. Does the critic from official opposition have an opening statement? Yes. Member for Roblin.
Thank you, Honorable Chairperson. And I didn't initially have an opening statement because I'd like to just get into the substance of the questions, but I feel compelled to respond to a few of the things the minister put into their opening statement. And first of all, I'd just like to help them with their understanding of rural Manitoba. Carberry is not actually located in the constituency of Turtle Mountain. It's in fact located in the constituency of Agassiz. I hope that's helpful. If it were possible, I think that the minister would be more interested in using their 10-minute opening statement to talk about all of the good work that their department is doing, hopefully, to make healthcare more accessible to Manitobans, to increase capacity, to lower wait times, but they didn't do any of that, which tells me that there's not a lot of good news to share. Instead, they spent 10 minutes engaging in partisan political attacks. It's clear that this NDP government is perhaps scared of the new leader of the opposition. They launched a Trump-style attack website about the leader of the opposition within moments of his win. And they used taxpayer dollars to do it. I think it's important that Manitobans understand that that's what the NDP is using their tax dollars to do. But that's not what we're here in this committee to do. My job in this committee is to hold the NDP to account for their broken promises and for their failures, and to ask on behalf of Manitobans when we can expect to see results. Because what we've seen in almost 2 years of NDP government is that things are in fact getting worse. Wait times are getting longer. The average wait time, the median wait time, I should say, in Winnipeg ERs at the moment is 4 hours. That's a decade-long high for the second month in a row. At the Grace Hospital ER in West Winnipeg, which serves my constituents, the median wait time is almost 7 hours. And 1 in 10 patients at the Grace Hospital right now is waiting over 16 hours for care. And you don't have to take my word for it. Frontline healthcare workers are speaking out about the NDP government's failures. The minister touched on the listening tour, and they seem to feel that they're being mocked for it. They're not being mocked for listening to healthcare workers. They're being questioned about the fact that nothing has resulted from all of that listening. And again, it's not just me saying that. The president of the Manitoba Nurses Union said just yesterday on social media, quote, "If the government had truly been listening during their listening tour, would we be here again over a year later with no measurable progress? Nurses are beyond tired of the spin, of being used for announcements, campaigns, and photo ops, only to be ignored when the decisions are being made," unquote. So if the minister is truly listening, then they need to heed the words of the president of the Manitoba Nurses Union and other frontline healthcare workers who are speaking up about the situation in healthcare right now under the NDP. They can deflect, they can look backward, they can try to blame, they can try to turn the conversation to Donald Trump, they can try to attack the leader of the opposition. But what Manitobans want and what Manitobans expect is accountability from the NDP for the promises that they've made and have failed to keep. Thank you.
We thank the member for their opening statement. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 21.1 bracket A contained in resolution 21.13. At this time, we invite the minister's staff to join us at the table, and we ask that the minister introduce the staff in attendance. Minister for Health, Seniors, and Long-Term Care.
Thank you so much, Chair. So the team that I have with me today is my Deputy Minister, Scott Sinclair, ADM, Sandra Henault, ADM, Suzanne Gervais, ADM, JP Fredette, my Director of Ministerial Affairs, Alyssa Brand, and Policy Manager, Michael Pereira.
Thank you, Minister. According to Rule 78, Bracket 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. Member for Rockland.
Thank you, Honorable Chair. I'm going to start with a few simple questions about the staff in the Minister's office. Can the Minister provide a list of all the political staff in their office with their names, positions, and salary classifications?
Minister for Health.
Thank you, Chair. I did have some additional comments for my opening remarks, but ran out of time, so I'm just going to continue those remarks first, and then I'll address the question after that. In terms of primary care, our government is building on expansions we made the last year in primary care. We saw over 138 net new doctors join our workforce here in Manitoba, which is a huge success and a team effort, and I want to be clear about that. Our government doesn't do this work alone. We have wonderful partners across the healthcare system. We have very, very talented people in our Department of Health, Seniors, and Long-Term Care who care deeply about the well-being of Manitobans and who work hard every single day to make a difference. And the strength of the folks in our Department of Health, Seniors, and Long-Term Care, working with post-secondary institutions, regional health authorities, frontline staff and healthcare workers, unions. We've been able to work with partners, the colleges, the CPSM. We've been able to work collaboratively to have a net new over 138 doctors join our workforce here in Manitoba. Almost 4,000 Manitobans, patients, have received care at our new minor injury and illness clinics. That's 4,000 people, Manitobans, who were able to get care when they needed it without waiting in an emergency room. Now, as we build up healthcare, we're going to add more extended hour primary care clinics. We've seen how well those have gone. We know that I think it's now at about 12,000 or 13,000 Manitobans have accessed our extended hour primary care clinics in addition to the minor injury and illness clinics, which is phenomenal. Our government launched medinav.ca, which was very, very well received, not only in Manitoba, but certainly across the country. We launched that website to help Manitobans navigate our healthcare system with ease and get them appropriate care faster. I've heard from several of our own colleagues and their family members who have benefited from Medinav. And we're improving access to primary care with investments to expand virtual care visits with nurse practitioners through QDOC. And I want to thank the Nurse Practitioners Association of Manitoba. You folks, these folks have been a wonderful partner. We've been able to work together to take steps like in our first budget, doubling the nurse practitioner training seats. We've added nurse practitioner job opportunities across the province. We're moving in the direction of making sure that nurse practitioners have more opportunities for different types of specialized training in post-secondary. It's a really important partnership with expert nurses across our province, and I want to thank NPAM for their collaboration. We know as a government that with better access to primary care, we will see better outcomes for patients across Manitoba. Something that's really important is access to surgeries. Our wait times for surgeries and diagnostics need to be addressed. Those wait times and backlogs were not cleared or addressed by the previous government. Addressing this has been a pillar in our strategy. And while the previous government did not build capacity here in Manitoba to address these issues, we're doing that in this budget, 25-26, as we did last budget. We've bought a new mobile MRI for the North, the first ever in our province's history, and we've got the staff in place to operate it. We're investing $4 million to add 800 new hip and knee surgeries at Selkirk Regional Health Centre, along with $13.7 million for Selkirk to open 30 new additional medicine beds, acute care beds. $8.5 million will go toward 50 new transitional care beds, and we will increase the number of fully funded critical care beds from 101 to 131 in our province. These are all significant investments and improvements, none of which could have been done without direct input from the front lines, from nurses and allied healthcare professionals, doctors, and team members who we've met on our listening tour stops, who have really helped inform the way our government invests in healthcare. And I want to thank all of those folks who have not only shown up to listening tour stops, but have actually followed up afterwards. We've had coffee, we've had meetings, we've had forums. We've been able to dig even further into the details of the ideas and concerns they've brought forward and work at fixing healthcare together. So I want to thank them. There's capital projects that are a priority for our government as well. When we say we're building healthcare, I want people to know that we actually mean that literally. Budget 25 sees funding for 3 new personal care homes in Manitoba, Lac du Bonny, Arbourg, and Park Manor in Transcona. So along with the emergency departments I've already mentioned, we will begin the work on the new cancer care headquarters in Winnipeg as well. And we're making very clear that we're holding true to our commitments to Manitobans who need to hear those 4 magic words as it pertains to cancer: you are cancer-free.
Thank you, Minister. Member for Roblin.
Thank you. The minister didn't answer the question about the political staff in their office, so I'll repeat that and add my next question as well. Can the minister please provide a list of all the political staff in their office with their names, positions, and salary classifications, and also a list of civil servants that are employed in the minister's office?
Minister of Health.
Thank you, Chair. I'll start with my Director of Ministerial Affairs, Alyssa Brandt, who is also in the room with us. So I'll speak extra kindly about my Director of Ministerial Affairs. I am going to elaborate a little bit just because I do think it's important. You know, none of us do our jobs alone. Certainly ministers don't do this work alone. We're fortunate to have some really, really incredible people, really incredible teams who do this work right alongside us and who are just as invested in Manitobans having a healthcare system that is improving for them, that serves their families and communities the best ways possible. Alyssa Brandt is my Director of Ministerial Affairs, is just a rock star human being, a really great person, someone who is loves this province, and you can see it in the way she does the work, and I can't thank her enough for her leadership on our team. She's a Senior Officer 7, which is interesting language, Senior Officer 7, but that's the official, I guess, designation. Yeah, and I just want to, again, thank her for her leadership on our team. Special Advisor's name is Raina Loxley, Senior Officer 1. Reina is just another really great team member, super smart, razor smart, sharp, loves graphs and charts. Certainly much more than I do. I see the value of them definitely, but it's really helpful to have somebody with the level of public health expertise that she brings to the team, and again, commitment to making healthcare better for Manitobans. Special advisor, specifically on policy, Michael Pereira. Professional officer 9. Really wonderful member of our team. Really has a strong understanding of, what Manitobans are paying attention to in healthcare. Brings a really wonderful lens in terms of relationship building in healthcare and working with leaders, which I think is really important. It's something that, we really didn't see a lot of effort, positive effort made by the previous government. So it's great to have folks on our team who bring that to the table in such a genuine way. Special Assistant Alan Menkowicz, Special Assistant to the Minister 4. Wonderful human being. Strong. People probably know Alan based on his advocacy in communities in many ways, but to have that level of integrity on our team has been a wonderful asset. El Shaddai Nayakir. We find that specific detail for El Shaddai's role, Senior Policy Manager 4. Super smart, super sharp, graduated with distinction from the University of Manitoba. A really brilliant human being, again, somebody who's passionate about making healthcare better for our communities. And honestly, just a superstar person, and I have full confidence that her career is going to be outstanding. Another really great person on our team that contributes in invaluable ways, and I can't thank her enough for her contributions on our health team. Sarah Fair, EXM4, Executive Assistant. Another really wonderful person on our team, cares deeply for our diverse communities, has a really good understanding of the importance of diversity, equity, and inclusion, and making sure that when we're in spaces, when we're doing a lot of the outreach that we do as a government and as a team, that everyone in the space feels welcomed and is heard. And I think that's a really important way to approach healthcare, and approaches healthcare through a compassionate lens in their role as the executive assistant. Issues Manager Charles Mancini, Professional Officer 9. Wonderful member of our team. Issues Manager, I think, kind of tells the story of some of the work that Charles is responsible for, Charlie's responsible for. But really and truly, again, we don't do what we do without our team members, and he is such an integral part of our team and making sure that we understand what's going on with Manitobans. We hear directly every day, but really keeps us up to speed to the minute on what's going on, and I appreciate that. Luke Gannett, Professional Officer 9, and Naileen Rampersad, Professional Officer 9. These are folks, Tour Officer is Luke, and Press Secretary Naileen. Again, just wonderful folks on our team. Can't thank them enough for what they do in helping us communicate healthcare issues and working together at really important tables on healthcare. Special
Order, please. Minister's time is expired.
Oh, great.
You have to recognize her, say that.
Member for Roblin.
I would invite the minister to continue their answer.
Honorable Minister.
Thank you so much, Chair. Special Advisor Eric Jacobson. I think folks are pretty familiar with Dr. Jacobson. I'll expand a little bit on my remarks in terms of him as our special advisor on health. Dr. Jacobson is a highly reputable physician, specialist here in Manitoba. He is someone who really and truly has incredible relationships across the healthcare system and has been practicing and been an expert for decades, has really historically done transformative work in our healthcare system in Manitoba. His voice, his expertise, his understanding of how to approach healthcare, how to close health inequity gaps, how to communicate effectively and build relationships with other physicians. His his role as a special advisor has really and truly been so helpful, so fundamentally important to what we've been able to execute as a government. We often talk about healthcare issues that are not actually related to critical care. We talk about that a lot, but Dr. Jacobson has been really a wonderful voice and expert when we're talking about the importance of enhancing and improving access to primary care. Really an innovative thinker in terms of how we can do better in the primary care space in Manitoba. And I really, it's been an absolute pleasure being able to work with him, and I can't thank him enough for his expertise. And I just want to go back to, speaking about the folks who do comms, because the way that we, or press secretary rather, which is pretty self-explanatory, but, we saw for a number of years under the previous government the way that healthcare was, of course, cut and dismantled, but also the way healthcare was talked about. And I think that's a really important area to focus on, because the way we talk about healthcare matters. It's so important. Government has a tremendous responsibility and opportunity to talk about healthcare in a way that emphasizes the invaluable nature of healthcare that we have. We have a public healthcare system here, universal healthcare in Canada, the Canada Health Act. These are all values that are so fundamentally important to protect and to strengthen. And our government takes very seriously our role in espousing that, sharing those values with Manitobans, and then backing up those values with investments, which is why Manitobans have seen us invest in strengthening public health care and care right here at home. And there are a number of experts we've been able to work with, folks across our healthcare system rather, who have been waiting for an opportunity to have their expertise heard, to contribute to strengthening our public healthcare system. And everyone also recognizes that after years of damage, it's going to take us time. It's going to take us years to fix that damage and really build up the healthcare system to where everyone wants it to be. But we're taking real action, we're taking meaningful steps, and we're seeing the benefits of all of that collaboration and those shared values really benefiting Manitobans, whether it's net new healthcare workers or net new beds. We're seeing the system take these steps and make a difference for folks, while also, again, recognizing that there's so much work for us to do. There's so much more we have to do to address the challenges and to really make healthcare a place that, across the board, no matter where you work, you have your needs met. And no matter where you live, as a patient, you have your needs met in the right ways, at the right time, in the right places. And so we're committed to continuing to do that work and making sure that we engage with and surround ourselves with experts and Manitobans who didn't have their voices heard for years, but genuinely now have a true partner and collaborator in government.
Thank you, Minister. Member for Roblin.
Thank you. Are any of the staff, the political staff in the minister's office on secondment or employed as part of an interchange agreement with another organization? And if so, which ones?
Minister of Health.
Thank you so much, Chair. So the response to that question would be Dr. Jacobson, Special Advisor. That's the one role. And then I'm just going to provide a little bit of clarity on the other roles. I spoke sort of, from my own personal lens, but I didn't provide the formal description for each of the political roles previously. So for Director of Ministerial Affairs, in that role, Alyssa supports the minister in advancing their mandate by providing strategic advice to move our government's health agenda forward, manages political staff in the office, ensuring they are supported in their duties, directs and participates in policy development, cabinet and treasury board submissions, legislative proposals, helps in communicating health initiatives effectively with the public and the media, lead point of contact for stakeholders. For Michael Pereira, it supports the minister in advancing their mandate through strategic policy development. Ellen Mankiewicz, reports to and manages casework, acting as a point of contact for MLAs. As the lead on agency board and commission appointments, attends meetings and briefings to support the work of the minister, maintains open lines of communication with stakeholders. El Shaddai Nayakir leads on the development of legislative proposals and legislative house processes. Works with the Seniors and Long-Term Care Division to ensure the advancement of Manitoba seniors' priorities. Attends meetings and briefings in support of the work of the minister. Charles Mancini supports ministers' offices and the premier's offices in the management of day-to-day issues. Provides services to a variety of ministers as well as needed, helping to manage day-to-day issues as well for other ministers, and not just the Minister of Health. For Luc Guinette, supports the Premier and the ministers in planning outreach events and tours to connect people across Manitoba, and he does a really, really great job of that. Naileen Rampersad supports ministers in responding to media inquiries, organizing press conferences and announcements, and engaging in strong media relations. And I believe that covers it, and I did answer the member's question on interchange agreement.
Member for Roblin.
Thank you, and I appreciate the additional detail about the staff responsibilities. So by my count, that's 10 political staff working out of the minister's office. But I noticed there's been some turnover. Can the minister disclose how much severance has been paid to previous political staffers during the minister's time as health minister?
Minister of Health.
I could be mistaken. I don't think so. I think the member for Roblin asked about civil servants as well. So I think I'd like to provide that information now. Jennifer Allworth is an AY4. And I actually, before I get into the names of the civil servant staff, I do want to acknowledge that the work that these folks do is honestly incredible. These folks are amazing. The sheer volume of correspondence that comes into health is remarkable. And, as a new minister about a year and a half ago, I thought to myself, okay, well, new government, that's probably to be expected, and it might to some degree change or slow down over time. It's not slowed down at all. The volume, if anything, it's increased. People are really eager to meet and have conversations. And I had the opportunity this week actually to sit at a round table with Grand Chief Sethi, Mayor Smook, Northern representatives, and it was really quite something to hear them talk about how, and Grand Chief talk about how they hadn't been welcomed into the legislature like this before, under the previous administration, to sit down and have regular meetings and conversations about how we can work together and address really important issues. And that means a lot. We take that, I know I take that very seriously. And the folks who are responding to, processing, handling, engaging with, mapping, tracking, a lot of that volume, all of those really, really important interactions from Manitobans who are reaching out to share ideas, experiences, et cetera. Civil servants are doing a lot of that work. It's incredible work that they do every single day, and they do it with such wonderful, wonderful attitudes and with such good-heartedness, and it really does make a difference. So I cannot thank them enough for what they do in our office, on our team. And I don't think we get the opportunity to talk about that enough. So I just wanted to express that. So Jennifer Hallworth is an AY4. Brenda Ranville is an ATM. Amina Mugosa is an AY4. Carly Schneck is a CL4. And Paulette Kramer is an AYD.
Member for Roblin.
Thank you for that. And I'm just again going to restate my previous question and add a little bit more detail to it. If the minister could please provide how many staff have left their office since October 2023 and how much severance has been paid to departed political staff.
Minister of Health.
Thank you, Chair. Budget 25-26 is a budget that we're really proud of as a government. Certainly, all of the budget we're really proud of. Health in particular, being the health minister, being a former healthcare worker myself. Take a lot of pride in the fact that our government is showing Manitobans that we continue to prioritize healthcare and to invest, to really and truly invest in making healthcare better. We talk about the fact that budget 25-26 is a budget that builds Manitoba. It really does. $3.7 billion to build. I should say it 3 times: to build, build, build. That's our mantra with this budget. And health is no exception. We've got some really important capital projects that are supported by this budget. It's a budget that finds this really important balance of, yes, investing in building healthcare, whether it's 3 personal care homes, reopening emergency rooms, doing the work to build a new cancer care headquarters, doing the work to reestablish the Mature Women's Center, all of these really important infrastructure projects. Also investing in what is required to make those buildings and projects and infrastructure a true success for Manitobans, and that's people. That's investing in the people who provide care on the front lines at the bedside. It's investing in training opportunities. It's investing in retention and recruitment, and really novel ways in Manitoba of doing the work of adding to our healthcare human resource capacity. And finally, getting Manitoba in the game, you know, as some folks might say, in terms of recruitment. It's something that other jurisdictions were pretty far ahead of us in regards to, and it's wonderful that we've been able to, as a government, work across departments to really move us in the right direction. Earlier today, in question period, our Minister of Immigration and Labor, who was doing a phenomenal job, really and truly a phenomenal job, came into her role, you know, with a department that had been cut by the previous government, with an approach that wasn't helping our immigration outcomes in Manitoba, and turned it around completely. Our first budget turned it right around. And she mentioned today, in question period, that the work that she has done to support us being able to have internationally educated healthcare workers finally have a pathway to practice in their own province has been done in partnership across departments. Minister of Business, Mining, Training and Jobs Creation, and myself, and Advanced Education and Training, we've all been working together to establish these historic projects, pilots, pathways to benefit healthcare workers and fundamentally benefit Manitoba patients and families. And so, you know, it's, I think it's really important for us to highlight the approach that's being reflected in this budget, the collaboration beyond our government with partners. It's important for us to reflect on the impact that we believe as a government it will have over time. Again, we know it's going to take time. That's just the reality of it. You can cut a bed in 2 seconds. It takes no time to cut a bed from the healthcare system. It takes much more time and effort to add a bed. We know this, which is why, you know, when we see that the previous government cut 500 beds from across the healthcare system, and our government is on track to add hundreds. We've already added hundreds, but I think right now we're close to 300 beds, and we're going beyond that. It's an aggressive timeline. We've been able to do that in about a year and a half, but we know there's much more to do. And that adding capacity where capacity was cut takes real time and sustained effort, and it takes true partnership. So all of that to say, you know, we're here to talk about Budget 25-26. I look forward to sharing and answering questions about that. And in terms of Budget 25-26, no, there has been no one who's left and no severance paid.
Thank you, Minister. Member for Roblin.
Just because I'm curious, because I had found him to be quite helpful in the past when I had questions. What is the status of Shamar Barnes and his employment with the Minister's office?
Minister of Health.
Yeah, I think it's really important to state for the record that Shamar Barnes is a wonderful person, just a wonderful human being who cares so deeply for this province. He's a really special person who we're really proud, and I'm really proud to have as part of our government. You know, the guy went and got a promotion, and you can see it on his social media if you follow him online. But I'm thrilled for him. Anywhere he is in our government, we're lucky to have him. And, you know, again, I think I'll take a couple of moments to not only talk about wonderful and dear Shamar, but just to talk about this team that we have, that's led by a premier who made history. And this government that we have that, for the first time in our province's history, looks like the province that we serve. A very diverse caucus. And a very diverse team. You know, again, none of us do our jobs in isolation. None of us can do what we do without our teams. without the infrastructure of people who show up and do this work because they care deeply about this province that they're a part of. And I am a very, very proud Prairie kid. I'm a very proud Manitoban and Canadian, and I feel pretty fortunate to be part of a government that is able to connect with communities in a really unique way, really important ways, understands the importance of representing all Manitobans, all entities, all walks of life, all income levels, all educational backgrounds. That's really important to us and for us. And so it's, it takes real effort and intention to build teams and community that look like the province that we serve, and we take that seriously. So, there's a lot of work we've been able to do, and we're grateful for that, to be able to serve Manitobans in this way. And we're going to continue to work very, very hard, not just in health, but certainly across government, to support Manitobans having better healthcare outcomes.
Thank you, Minister. Member for Roblin.
Thank you. Glad to hear that Shamar is doing well. And in the spirit of appreciating staff, I, of course, wouldn't be able to do the job that I do without the staff that we have in the opposition caucus. And as the minister will know, being in opposition is quite different than being in government in terms of the staff responsibilities, the number of positions that we have, and opposition staff are expected to do quite a bit of work and to wear many different hats. So we're very fortunate in our caucus to have dedicated and talented staff who are issues managers and communications officers and policy analysts all rolled into one in many cases. So I know that my colleagues will agree with me that their role in our ability to do our jobs is essential, and I just want to put on the record how much I appreciate them. I'm going to shift my questions now to healthcare services under the minister's purview. And I have so many questions, I'm just trying to decide where to start. I think I'd like to start with the ER wait time strategy announced last week. There was no, in the strategy itself, there was no goal listed, no wait time reduction target. That came out in the media that the minister is intending to reduce median ER wait times. And it wasn't clear if that was within the province, is that in Brandon, is that in Winnipeg, by 1 hour. So I'm just wondering where that goal came from, why it's not in the strategy, and if the minister could provide more details about that 1 hour reduction. Is it in Winnipeg? Is it in rural Manitoba? Is it in Brandon? I think those details are important.
Minister of Health.
Okay. Sorry. Thank you, Chair. So the lowering wait times, lower wait times, and system improvement team. First, I want to say thank you to all of the experts who are taking part in this historic effort. We've actually, in Manitoba, we've never had an effort like this. We've never had a team, a table of experts come together in this way to address really, really urgent and important needs in an emergency department and, quite frankly, the system as a whole in this regard. The folks who are doing this work are dedicated practitioners. These are experts. These are people who have a personal connection to the healthcare system. If folks watched the announcement, they would have seen that our engineer, Heidi, shared her own personal story, it's a heartbreaking story. It really is. And it's pretty incredible. And I think it's really a testament to Manitobans that through that heartbreaking story and that journey for Heidi and her family, she is willing and wanting to be part of an opportunity to make healthcare better, to improve emergency department performance, to improve the system so that other families don't have that experience. The priorities that are outlined in the strategy really speak to a few key areas, one of which is staffing. We've hired a net new over 1,600 healthcare workers. Our government is going to continue to aggressively do that work and set really ambitious targets. But it's also about primary care. We know that. It's also about making sure that Manitobans have access to the primary care that they need in order to mitigate folks trying to get their primary care needs met in emergency rooms, which we know has been happening. We have stood up, extended our primary care clinics, minor injury and illness clinics to address that. And we're seeing thousands and thousands of Manitobans benefit from that infrastructure. Beds are a big part of this conversation as well. We've added hundreds of beds to our healthcare system, be it in medicine, family medicine beds, critical care, psychiatric care, transitional care unit beds, beds in community for folks who are unsheltered, who need maybe more wraparound supports and services. We've added a number of beds to help take some of those pressures off the emergency department, and that work, again, is ongoing. The two big metrics that this team of experts is working really hard in collaboration with sites across the province and the front lines. The two metrics that they're really working to address here are the waiting to be seen times and the left without being seen times. So those two really important, metrics, rather left without being seen percentages. And so there's a number of initiatives outlined that this team has been working on. They've been having a lot of important conversations, assessing directly on the front lines what's happening at different sites, listening to service providers. I myself have been able to participate in really meaningful conversation with different programs that have a direct relationship with emergency department performance. You know, a big part of this conversation is addressing flow through our system. Access block is the language that people are most familiar with. And so those are the two metrics that we need to address. And as a government, we want Manitobans to have the best. We want the best for Manitobans who are accessing care in our emergency departments. And so we are committed to working as hard as we can with our experts and with our partners to move wait times in the best possible direction, to lower those wait times, to improve the system, and to make sure that this is a long-term, sustained effort. And so for our government, it's about trending those numbers in the right direction, keeping those numbers trending in the right direction, but making sure that we are getting the best results possible for Manitobans.
Thank you, Minister. Member for Roblin.
Thank you. Okay, so there was not a lot of clarity in that answer about where the 1 hour wait time target came from or what it applies to. But that target is out there, so I can only assume that the department has done some analysis of the additional capacity that's going to be required in various areas of the healthcare system to achieve that target. So I'm wondering if the minister can share, for example, how much additional capacity is required within the home care system in the city of Winnipeg to lower wait times in our ERs, because as we know, that's closely tied to the bed block issue.
Minister of Health.
Thank you, Chair. While I wait for clarity on some information for the members, some specific numbers, I will offer some thoughts and some of the work that we're doing. The critic is correct that there's a lot of work that needs to happen in order for aspects, the strategy as a whole, but certainly initiatives to be effective. I mentioned earlier, staffing is a huge part of that. And as Dr. Olofsson talked about at the announcement, and Dr. Olofsson is a co-chair of this team, she really emphasized that much of the work that needs to be done is actually in community. So much of the work that needs to be invested in and capacity built needs to happen before someone ever, gets access to or goes to an emergency room for care. And that's a really important part of this conversation. The critic is correct that home care is a part of that conversation. As a government, we've worked really hard to expand opportunities for more home care to be not only accessed by Manitobans, but obviously to train people to provide that care. So there was an initiative that was run out of the WRHA to credential folks in community as healthcare aides, and we've expanded that across the province to other regional health authorities. We really encourage other regional health authorities to see that as a valuable approach and to see the benefit of training people to become healthcare aides, and also ensuring that they have the opportunity to essentially ladder up their skills. So perhaps you begin your career as a healthcare aide who's not fully certified just yet, but then you have the opportunity to maybe challenge that process, the examination that you would normally have taken, and then you become fully credentialed as a healthcare aide. We know in Manitoba that healthcare aides have the ability to also skill up within their profession. So perhaps you're a healthcare aide with, the training that you've received, and then you get additional training to become an operating room attendant, healthcare aide, someone who actually gets trained on different skills in the ORs. I had the opportunity to meet some of those folks recently. They're phenomenal people. They're so passionate about what they do, and they're really invaluable to the teams that they're a part of, whether it's in thoracics or other aspects of our surgical care system. And so, encouraging regional health authorities to take that initiative and provide enhanced training opportunities for folks to become HCAs, home care workers, has been really beneficial. Again, we recognize there's much, much more work to do. And we want to make sure that we create the conditions where these folks want to practice. Bargaining fairly, settling agreements has been a big part of that. Our government was able to successfully see an agreement established with 25,000 support care workers. That was a huge deal. 25,000 Manitobans who previously had their wages frozen for years were never allowed to get to the bargaining table. So that's work that we're doing to improve access to training opportunities, improve access to care in communities, and also shift the narrative in terms of the experience that healthcare workers had for many years previously. As of March 2025, March 31st, 1,700 healthcare aides were hired. Net new home care workers were hired. That's a big number. That's healthcare aides who are now part of our front lines, who are providing care to Manitobans every day. And I can't thank them enough. I had the pleasure as a frontline nurse to work with many healthcare aides, highly skilled folks who are invaluable to multidisciplinary and any healthcare team they're a part of.
Thank you, Minister. Member for Roblin.
Okay. So while we're waiting for an answer to the question about capacity that's required within home care to achieve that ER wait time reduction target, I am going to ask a different question. In March, the government announced that it was taking steps to entice American healthcare workers, I think specifically nurses, to come and work in Manitoba. Can the minister provide a status update? How many nurses have come to work in Manitoba from the U.S.?
Minister of Health.
Thank you so much, Chair. While I wait for the numbers on that piece, the U.S. recruitment of nurses, I do want to take this opportunity to talk about the importance of a time that we're in terms of recruitment. Here in Manitoba, we, like folks across the country, we are watching healthcare workers in the United States be treated unfairly in many ways, be navigating an experience that is scary for some folks, painful. Some people have described it to me, some American healthcare workers have reached out to me and described what they're dealing with in their home states and communities as terrifying. That's the language that healthcare workers that have reached out to me from the US are using. And what I've also heard from American healthcare workers is that, they've gotten to know a little bit about Manitoba over the past 18, 19 months or so. And they like what they see. They like what they see here in Manitoba. They see a government that is standing up for healthcare and healthcare workers, a government that recognizes that although healthcare, there are real challenges in healthcare, that if we work together, we can address those challenges meaningfully. And that, Manitoba is a place that welcomes people of all backgrounds, experiences, and identities. And we will support you collectively to have the best outcomes possible. That message, that reality of what we're all working and striving toward as a province is resonating for folks in the United States. And I think that's something as Manitobans we should be proud of. I think as Manitobans, we should be really proud that in the last provincial election, Manitobans sent a very clear message. They rejected hate, they rejected division, they made it very clear that they don't believe it's right for marginalized and vulnerable people to be targeted by governments. And that was a response that Manitobans had that wasn't just observed in our own province. Across the country, in the United States and internationally, people were paying attention as a result. And so the healthcare workers who have reached out to me from the US, I want to say thank you. Some folks have shared some really painful personal stories. I actually met a US-trained paramedic a couple of months ago, and whose wife is a physician in the United States. And they come up here frequently in the winter months, believe it or not, yes, in our winter months, to enjoy our outdoors. And they were asking questions about, how could they potentially work in Manitoba? Had many of these conversations. I know my colleague, the MLA for Kirkfield Park, has had those conversations with US-trained health professionals as well. Many of us are. And we have, as a result, been successfully able to recruit and welcome US-trained healthcare providers to Manitoba. And we're in ongoing conversations with many, many folks. This is an opportunity for us to not only strengthen our healthcare system, but to really welcome people to calling Manitoba home. We know that in our province, no matter anywhere actually, but one of our values and understandings here in Manitoba is that diversity is a strength. Diversity makes our healthcare system stronger, and when we welcome diversity with open arms, it can lead to better outcomes at the bedside. And so there are folks that as recently as last week I was talking to who trained in Minnesota, who are looking to come to Manitoba, and we're actively working with them. And there are steps that our government is taking, working with different colleges, so the CPSM, College of Physicians and Surgeons of Manitoba, College of Registered Nurses of Manitoba, to make sure that the pathway to practice is barrier-free for those who are trained in the United States. We also recognize that there's work to do to make sure that folks can acclimate really well to Manitoba. They can have a soft place to land here, not just in terms of landing from their flight, but really landing in community. And we're committed as a government to supporting those efforts and making sure that people really enjoy not only being a part of our communities, but practicing in our healthcare system as well.
Thank you, Minister. Member for Roblin.
Thank you, Honorable Chairperson. We're getting quite backlogged here with questions that have not yet been answered, and I'm not clear if it's because the minister's refusing to answer or because they're just waiting for information from their staff. So just to backtrack, we are waiting for information about how much additional capacity is required in the home care system to achieve the ER wait time reduction target. We are waiting to hear how many nurses the government has recruited from the US.
Minister of Health.
Thank you, Chair. So to date, we are actively and successfully recruiting about half a dozen American-trained nurses with much more work going into that process. This is a more obviously recent development for us in Manitoba. We've certainly expanded our efforts to the Retention and Recruitment Office to have an expedited pathway list of countries. Previously, Manitoba did not have that at the college level. Other jurisdictions have had that for quite some time, but here in our province, we didn't have that. So we work with the College of Registered Nurses to make sure that we had a list of countries, and we continue to do that work with them. Those relationships are really important. We recognize that there are jurisdictions where there's comparable education and really strong health infrastructure, and we should be supporting folks who want to practice in Manitoba from those countries and being able to do so. I'll also note that we've had many internationally educated nurses here in Manitoba for many years, for quite some time, who never had a pathway, who never had an opportunity to be a part of a process to practice in our province. As I stated earlier, we've worked very closely in partnership with the Minister of Immigration, Minister of Advanced Education and Training, Minister of Business, Mining, and Job Creation in order to develop a pilot pathway, which has been very successful. We've already had folks graduate. As the Minister of Immigration already stated, we're looking at about 80 graduates. These are folks, again, who have been living, working, raising their families here in Manitoba, who previously didn't have a government that was willing to support them and work with them to create a local pathway to practice. And so those are IENs, who some of which from the United States, who have been living in the province, who now have a way to join our front lines. This effort in terms of specifically, I guess you could say, targeting the states in terms of recruitment is more recent, and we've had webinars where we've seen dozens of nurses participate and attend and get information. As I said before, people are becoming more and more familiar with Manitoba, which is a good thing. This is a great province, and we want to welcome as many folks as possible to join our healthcare system. So I've had the pleasure of talking to some of these nurses who are interested, who are actually in the queue myself, some of which are young new grads who are very, very eager to work in our province, and not just in Winnipeg. I think folks want to work in rural and northern communities, which I think is phenomenal, right? We need to make sure that as we're doing this recruitment work, that we're not focusing solely on urban settings, that we're focusing on the needs of rural communities and northern communities. And in my experience going out and meeting with, whether it's Reeves or mayors or council members in rural Manitoba or health committees in rural Manitoba, folks are very, very keen to welcome internationally educated professionals and to support them and their families in being a part of their rural communities and calling rural Manitoba home, or northern Manitoba home. And so we're going to keep this work going. We're in conversation with many physicians as well in the United States, and we look forward to welcoming more and more nurses to our healthcare system in the province from the United States.
Thank you, Minister. Member for Roblin.
Thank you for that. I just wondered what changes the minister is considering making to make it easier for nurses within Canada to come to Manitoba, or for nurses who are practicing at a different level to perhaps become RNs. I'm thinking of a nurse that I spoke with who is an LPN, and her understanding was that an IEN could come in and challenge the RN exam, but she, as an LPN, a practicing LPN in Manitoba, could not do so. So I guess there's two different questions there. We've talked a lot as a province and as legislators in the chamber about interprovincial trade barriers, and one of those is labor mobility. And there is labor mobility legislation, of course, and I realize that a number of these issues fall under the purview of independent regulatory bodies, but certainly the government has worked with colleges to streamline entry requirements at times. So it's sort of a two-part question. What changes is the government making to make it easier for nurses to move between provinces and come and practice in Manitoba? And what, if any, changes are happening to make it easier to increase the number of nurses we have practicing in the province?
Minister of Health.
Thank you, Chair. You know, it's interesting, this conversation that we find ourselves in, right, during this particular time around what's happening in the United States and pathways to practice and all of that. And I do think that first and foremost, I would say that our government has done a few key things to support nurses practicing in Manitoba. One, we ensured that they were able to collectively bargain fairly instead of having their wages frozen for over 4 years and get a fair deal. I would say that's a pretty important approach for any government or administration to take. Nurses were certainly not met with respect under the previous administration, and you know, their wages being frozen for multiple years, not the best approach, certainly. So I would say first and foremost, treating nurses with respect, listening to them, making sure they can bargain fairly. It's a pretty important step to take as a government, and we were very happy to be able to do so. We're going to continue to treat nurses with respect. I would also say that, you know, our government has been very clear. We support Manitobans. We support Canadians. We're proud to be Manitoban. We're proud to be Canadian. We support a strong public health care system. We believe in strengthening and protecting that. We are protecting Manitoba jobs. That includes healthcare jobs. We're creating more jobs and opportunities. We're making life more affordable. In contrast, the PCs are thanking Donald Trump for tariffs, the same tariffs and the same terrible approach to you know, attacking a sovereign country's economy and autonomy that is resulting in U.S. healthcare workers wanting to come to Canada, including our province, our great province, which we are and will continue, bless you, to welcome them with open arms. Those are really important approaches that our government is taking. And certainly sharing the message to nurses locally that we're here to listen, that even if things are challenging, we're going to listen, we're going to work with you, and we're going to action your ideas. Our government, myself and community partners, MNU, the College of Registered Nurses of Manitoba, different registrars, went out many months ago and announced that we are making it easier for Manitoba nurses, for Canadian-trained nurses who had recently retired, to rejoin our healthcare system. That pathway was made much, much easier and faster for those folks. And as a result, we had about over 60 recently retired nurses rejoin the front lines of our healthcare system. I had the opportunity to speak to a nurse actually at an announcement in rural Manitoba. It was in Lac de Bonnie, actually. A wonderful, recently retired nurse, over 30-year career in healthcare, who rejoined the front lines of our healthcare system when she heard the call, and she knew that our government was working with our partners to make it easier for her to do so. Our pilot program, again, for Manitobans who have been living in our province for years and never had a pathway to practice, we developed a pilot to get now 80 of these nurses, IENs, they're Manitobans who have been living here for a long time and finally have a way to practice in our healthcare system. We have been working with the colleges, certainly with the CRNM, constantly clarifying their obligations as a college to adhere to the free trade agreement, to respect and support the portability of nurses in and out of Manitoba, certainly into Manitoba, and to join our front lines. And this question, the question that the member for Roblin, the critic, asked in terms of the bridging is really what she's referring to, program opportunities. It's really a question for advanced education and training. But what I can say, because we do work collaboratively, is that our government has been working to make sure that that is a very robust opportunity. So bridging from LPN to RN-BN status, that it's very robust and that it's an opportunity that, from what I've heard from LPNs themselves, that is more timely. So a duration that really better meets their needs. So that work has been happening, recognizing that it's important to get input from LPNs themselves, which we've been able to do. And I want to thank the LPNs who have reached out to me, including the new grads that I saw just a handful of weeks ago at the new grad day. Many LPNs there, pulled me aside and had questions and concerns and ideas for what we can do in healthcare. And I want to thank them for those conversations. And we're working very hard to make sure that there are opportunities to bridge, to ladder up skills, to pursue opportunities in our healthcare system.
Thank you, Minister. Member for Roblin.
Thank you. One of the success stories of the previous PC government was the creation of the provincial nurse float pool. So I wonder if the minister could just update us on how many nurses are now part of the provincial float pool and how many hours the float pool worked in the last fiscal year.
Minister of Health.
Thank you, Chair. The provincial float pool is a tool that we have as a province to meaningfully not only address staffing concerns, but to provide an opportunity and a competitive offer, quite frankly, for nurses to return to the public system, which is a very, very important priority for our government, wanting to take all necessary steps to strengthen our public health care system. Again, during a time where we see the leader, now leader of the opposition, thanking Donald Trump for tariffs and actually touting the privatization of healthcare, American-style healthcare. And I know the member for Lac du Bonny wants to heckle me right now in committee because it's tough to hear. It's tough for me to say. I couldn't have, if you had asked me a year or two ago whether or not any member of the Legislative Assembly would be thanking a foreign government for their open attacks on our sovereignty as a nation and attacks on our economy and our fiscal health and healthcare system, I probably would have said no way. You know, we maybe sit on different sides of the political aisle, but surely we're united on this issue. Surely we understand the importance of being united fundamentally as Canadians in protecting the structures that protect Canadians of all backgrounds, identities, and socioeconomic status. Not perfect, work to do, but surely we're united on that front. And so it has been troubling, very troubling for us, and certainly for me as the health minister, to see the leader of the opposition thank Donald Trump for tariffs and for an approach to healthcare that would really harm Canadians and Manitobans. We have taken a different approach. We have really found ways through partnership to maximize the opportunity that we have with the float pool. The provincial float pool, again, is a tool that we can really use to encourage and support nurses in returning to the public sector, which is really important. And I'm happy to say that in one fiscal year, in one budget, we were able to see a 117% increase in nurses participating in that float pool. Approximately 300 nurses are now a part of the provincial float pool. We've had over 10,000, about 10,634 shifts filled, 127,610 hours worked as a result of that float pool, with much more to come. Our government is actively working with MNU, actively working with Shared Health, working with all of our partners to make sure that we're taking the necessary steps to build capacity in the float pool, and again, continue to recruit back to the public system nurses who left in droves under the previous government because they were disrespected, because their jobs were cut from underneath them, because their emergency departments were cut and closed, and because they knew that government at that time didn't have their back. We're taking a different approach, and we're going to keep enhancing the float pool so that we can continue to strengthen our public health care system.
Thank you, Minister. Member for Roblin.
Thank you. And, you know, while the minister says that they're taking a different approach, I think what we've seen and what all of us as legislators should be concerned about is the fact that nurses are not happy with this mint. And I'd like to put their words on the record because I think that's important. They are the experts here, in fact. Manitoba Nurses Union President Darlene Jackson told the Winnipeg Free Press on January 12th of this year, quote, "Our nurses tell us continuously that things are not getting better in healthcare, that in fact there are areas where things are deteriorating. Nurses are frustrated. We were promised a change," unquote. And more from the Globe and Mail earlier this year, quote, "The Manitoba Nurses Union said despite the new hires, its members have yet to report any noticeable relief. The union said it would like to see improvements in the working conditions for nurses, including a reduction in mandatory overtime. Without addressing the working conditions, no matter how many nurses they hire, we will continue to struggle with retention," said Jackson. Again, Ms. Jackson told the Winnipeg Free Press earlier this year, quote, "I think this is a wake-up call for the public to say to government, this is not acceptable. Things are not rosy in healthcare, despite what's been said. We are in a terrible crisis." She also said, quote, "Our nurses tell us continuously that things are not getting better." And just yesterday, the president of the Manitoba Nurses Union said publicly, quote, "If the government had been truly listening during their listening tour, would we be here again over a year later with no measurable progress? Nurses are beyond tired of the spin, of being used for announcements, campaigns, and photo ops, only to be ignored when the decisions are being made," unquote. So I just wonder how the minister can claim to have made so much progress and claim to be a listening government when frontline healthcare workers in our healthcare system are saying the exact opposite.
Minister of Health.
I'm happy to answer that really important question. And the member for Lac du Bonnet is smirking at me from across the table. I'm not sure if he's trying to intimidate me or what exactly is going on over there, but that's a really important question that I'm happy to answer. You know, our government recognizes that after 7.5 years of nurses being mistreated, being disrespected, being harmed by the previous government, that it takes time, it takes real time to affect the kind of change in the healthcare system that a lot of nurses are wanting to see. Now, we recognize that collectively, by listening to nurses, by listening to the front lines, we have been able to take some really important steps, but there is much, much more work to do. I've had the opportunity to meet with MNU, to meet with Darlene Jackson. I take very seriously concerns they bring forward. I take very seriously the ideas, the issues that they bring forward on behalf of their members. And as the minister and as our government, we are committed to continuing to not only listen, but to take the actions necessary to ensure that we can change the experience for the better that nurses have in our healthcare system. We know in very real ways that there are areas of the healthcare system where things are moving in the right direction. We know that there are areas of the healthcare system we have much more work to do, and we're committed to doing that. That is in contrast to the previous government's approach where they just slammed the door on nurses, quite literally froze them out, shut them out, froze their wages for years. Of course nurses are frustrated. Of course nurses are tired. You know, this was how they were being treated during a global pandemic, mind you. Nurses are still recovering from that. So I take to heart what nurses have to say, and we take their feedback very seriously, and we're going to keep working very hard to improve the healthcare system for nurses. I think about the fact that nurses, when I was in opposition as the critic for health, were telling me how unsafe they felt in healthcare, and how for years under the previous government, they had legislation in place to hire and train institutional safety officers, something that nurses called for, that unions called for. The previous government didn't do it. I was shocked to become the minister and to see that no direction had been given, no action taken out of the minister's office to make the workplace for healthcare workers safer by implementing institutional safety officers that everybody agreed were important in doing that necessary work. And so we set a target to have institutional safety officers trained and on site by the spring, and we were able to deliver on that. And that's not to pat ourselves on the back at all. It's to say that we recognize there's work to be done, that we need to take steps to make sure that nurses and healthcare workers are safer, and we're doing that. But there's much more work to do. So our government's going to keep doing that work. We're going to keep listening to nurses. We're not shying away from feedback or criticisms or concerns. We welcome it. It's being open and listening and taking action that improves our healthcare system. And I know that nurses didn't have that for 7.5 years, and I understand the harm that did. I hear that from the recently retired nurses, the 60 plus who have returned to the front lines of our healthcare system under our administration. So we're going to keep doing that work together, improving the healthcare system for nurses and healthcare workers. And I'm always happy to meet with healthcare workers to have these really important conversations. And I want to take a moment to thank the healthcare workers who have reached out to me to share their hopes for healthcare. And I want them to know that our entire team is here to continue to work with you on your behalf to improve healthcare and the conditions that you work in.
Thank you, Minister. Member for Roblin.
Thank you. I know the minister and the NDP campaigned on ending mandatory overtime, and I think when they were in opposition, the minister twice introduced a bill that would end mandatory overtime for nurses. So I just wonder when the minister plans to follow through on this commitment and end mandatory overtime for nurses.
Minister of Health.
Thank you, Chair. I know that the critic definitely understands and appreciates that in order to make a dent in addressing mandatory overtime, well, we have to staff, right? It's all about making sure you've got more people on the front lines. It's about being able to hire net new nurses and healthcare workers, and it's about being able to retain the healthcare expertise that you have in your healthcare system. That is something that as a government we've taken very seriously. When I came into the role, we're all getting settled into our portfolios and learning, what's been going on behind the curtain, some might say. When you're in opposition, you have very limited access to the information in the ways that you would like. And I was pretty stunned. I was very stunned, actually, to realize that the previous government didn't prioritize collecting information or tracking data or measuring outcomes in a meaningful way. The talent is in the department. The talent, the desire to take that approach, most definitely there. Previous government just didn't see any value in it, or I guess perhaps they were likely a little worried about what the information would tell them if they really dug in and authentically assessed the numbers and the impacts of the decisions they were making in healthcare. We thought it really important and really valuable to establish a foundation of getting this information, of getting this data, and using it to inform the approaches that we're taking in healthcare. We set up a retention and recruitment office dedicated to an approach that we've never seen happen in our province before, bringing people together, streamlining the efforts to retain and recruit healthcare expertise, to lighten the load for regional health authorities and physician clinics and partners across the healthcare system, and do some of that work for them and with them to ensure that we can more consistently staff and in targeted ways staff our healthcare system. And very quickly it became clear that there were real benefits to gathering that information and to segregating it and doing the work of establishing that evidence-based foundation. It certainly really helped us focus our efforts. It's helped us have really meaningful and transparent conversations with our partners. We provide that information to folks when they ask. And as a government, we set this target of 1,000 new healthcare workers in our first budget, and we surpassed that. Again, that's not to pat anybody on the back, I'll pat our partners and our team for all the work they've been doing on the back, but as a government, we know there's much more work we have to do. There's many more healthcare workers that we have to hire into the healthcare system and retain. But a really important part of that equation is nurses, right? We know, again, to address the mandatory overtime challenge that was exacerbated under the previous government, you have to staff the healthcare system. And so we were able to share not that long ago when we announced 1,255 net new healthcare workers that we had successfully recruited a net new 481 nurses. To date, we know actually that we've been able to successfully recruit over 600 net new nurses to the front lines of our healthcare system. We know we need many, many more than that, but we also know that we're moving in the right direction, and that's work that will continue. I was at a new grad day event a few weeks ago, and 2 years ago I was there with the Premier, and of course everybody in the room so they saw the Premier. I'm chopped liver when the Premier, they see him, they're excited, they get to ask him questions, and he's just great. He just knows how to connect with people. But there's about 200 new grads in the room that day. And when I went back to this event a few weeks ago, there were over 300 new grads in the room. We're moving in the right direction in terms of graduating nurses here. Well over 90% of those nurses are staying right here in Manitoba. I was at the nursing colleges, oh my goodness, not the college. I was at the nursing school summit. They had this really wonderful academic summit a couple of weeks ago, and I was able to bring greetings. And they had people from all over the country coming here for this conversation in Manitoba. And a really amazing non-binary presenter from the United States was there. And that's the environment we're creating, where we're getting talent, nursing talent from everywhere coming to Manitoba. And I definitely made a point of encouraging that presenter to perhaps consider moving to Manitoba and practicing here. I hope that they're open to it. But again, well over 600 net new nurses to address those mandated overtime concerns. hundreds, thousands more that we need to make sure join our healthcare system in the province.
Thank you, Minister. Member for Roblin.
Thank you. I see we're running very short on time here. So I will leave with one question that remains unanswered from earlier in the session. I asked about the additional capacity that's required in the home care system to reduce ER wait times in the WRHA. Still waiting for an answer to that question.
Order, please. The hour being 5 p.m. Committee rise.